For today's dissection, we're going to begin by pinning back the skin and the muscle. We'll also remove the liver, the digestive system, and any fat bodies if they are in the body cavity so that we can see reproductive structures as well as the kidneys. If you have a female, you may see a couple different things, but along each side of the body cavity, this tightly coiled tube is called the oviduct. We'll see that on both sides. And they're kind of wrapped around these long structures called the kidneys. They're kind of dark in color, almost like a maroon or a purple in color. You may also see some eggs beginning to develop in her body cavity. If these eggs are a little more developed, you'll also see that the oviduct is slightly swollen and is taking up more space in her body. And those, of course, are still wrapped around these two kidneys, which may be partially hidden behind the eggs, which are a little more developed. So both of these diagrams represent female. It all kind of depends on where she is developmentally. If, however, you have a male, we're going to look at this diagram down here. Once the reproductive structures are exposed, once the digestive system has been removed, you'll notice that on each surface of the kidney, we have something called a testis. And this, of course, is where the reproductive cells are produced. When I look at my frog's body, I have the skin and the muscle already pinned back for us. And I've already cut the connective tissue holding the organs in place. So you'll begin by using your forceps and your scissors to gently lift and cut around the liver so that you can remove it as one piece, which I've already done. And when we flip to the back, now we'll definitely be able to see that gallbladder full of bile. We'll keep that on our dissection tray. I've cut the top of the stomach close to the esophagus and down here by the cloaca. Now I also had to lift and kind of cut some of the connective tissue holding the digestive system in place so it could all come out as one long tube. So you can see the small intestine coiled up as well as that large intestine leading to the cloaca. Now when I flip the stomach over, I can also see this round structure here, which is called the spleen. There's also a fat body connected to it. Here's another fat body that I can remove. Okay. And once I have that out of the way, now I can clearly see the heart as well as these two lungs, okay, kind of behind it and to the left and right of the body. When I look inside of my frog's body cavity, I'm going to zoom in just a little bit now, I can see this coil here, this tube. On either side, that's oviduct, and here are some developing eggs. So mine is definitely a female. And this darker purple structure here is a kidney, and the other one's partially hidden by these eggs that are developing. Okay, so if you have a female, look for this tube. If you have a male, look for the kidney, and then you'll see those testes attached to each of those kidneys.